For example, we know that in terms of emergency care, that a lot of patients that present, actually, if you use something called same-day emergency care, you have rapid assessment, you have diagnostics on site, you have senior clinicians all operating in one area, then you can make those decisions so patients aren't admitted to the hospital. So the urgent emergency care has been considerably enlarged, and all of those sort of the emergency department, urgent care center, the same-day emergency care, the frailty unit are all co-located, and at the center of that is a diagnostic hub, because we know that patients require ultrasound, CT 24/7, and there's no point in them going 200-300 yards up and down the corridor. It needs to be right there. The other example is we know that if you become sick, and the demographics of the population, then even if your care can be managed in the community, actually if you come in sick, you're more likely to be really sick. So we've doubled the size of our critical care unit. So that, yeah, and for elective care, we know that for elective care that we do a lot of procedures. So there's benchmarking of operations and how many you can perform as day cases. We have the clinical skills to do that, but we're hampered by the environment. So if you have a correctly kitted out outpatient area, you can do more of your operation. You can do more of the day cases in outpatients, and you can actually do more of the inpatient theatre work as a day case procedure. So it's all of that work, and plus, for example, we know even in elective care, whether you've got cancer, whether you've got other health problems, you're going to need more diagnostics. So we put in more endoscopy for cancer screening. We've got, at the moment, we have one MRI and one mobile MRI. In the new hospital, there will be 3, all as part of the build, and the number of CT scanners will increase from 2 to 5. So these are examples of where we see the future models of care and how the hospital and the equipment within it facilitates. And I could go on about maternity, children and young people, inpatient care. And the other bit that is really important is the whole infection prevention and control. So having more single rooms. So if we had a norovirus outbreak, we would close, had 1 or 2 cases, you have to close the whole ward, because we'll have a minimum of 70 or 80% single rooms, A, privacy and dignity, and secondly, if you have one area of a ward that has to be, not used because there's a break there, you can actually carry on quite safely with the other bits. And pandemic proofing is really, important. And of course, the privacy and dignity. So, if you had 2 or 3 hours, I could go on, but it just gives you an example, and it's why the staff are so enthused about this, because it's they work in a really old building, but they also see that actually the way the department is organized within a hospital, and we've added on little bits. I mean, I've been a consultant there at 25-30 years, so we've added on different bits in the wrong places, and this is a once in a lifetime opportunity to get it all right, really.